moment I begin my talk, two questions will go through your mind. First one, because of my wonderful accent. Where does she come from? So let me satisfy your curiosity. I am from Croatia, born, raised, and educated there. Here you can see my small town of Punat on the island of Krk, where I spent all my summers in Croatia dreaming about big world out there. Then the second question I always get, why did I choose to do type 1 diabetes research? Do I have type 1 diabetes? No. Anybody in my family? No. Then why? Honestly, I chose it for love. I know, you're even more confused now, right? So, as a young medical doctor from my small hometown, I couldn't get a job in the Croatian capital where a guy I was in love with, don't worry, he's my husband today, lived. So I accepted a PhD position in the largest Croatian research institute to bridge basic type 1 diabetes research with clinical applications. That's how it all started. So let's talk about type 1 diabetes now. There are several types of diabetes, type 2 and type 1 being the most common. Type 1 diabetes is an autoimmune disease in which immune system cells, specifically T cells, destroy pancreatic insulin-producing beta cells. The consequence of such an attack is a lack of insulin and a chronic increase of blood glucose levels. Type 1 diabetes is the most prevalent metabolic disease in children and adults. In contrast, type 2 diabetes affects middle-aged and older people like me. And it's basically linked to insulin resistance associated with obesity and being overweight. Of the entire population of the United States, of over 300 million people, 38 million people live with diabetes. 90% of them having type 2, and about 5%, 2 million, having type 1 diabetes. Now, let's see how type 1 diabetes develops. Basically, the process starts months to years before the first symptoms begin. In the beginning, there is just a genetic risk. So basically, your healthy child might sooner or later develop autoimmunity triggered by a particular environmental factor. In the stage 1, preclinical diabetes stage 1, several biomarkers, such as beta cell-associated autoantibodies, can be detectable in the blood. In stage 2, in addition, even glucose metabolism is dysregulated, and those biomarkers can be detected. Finally, stage 3 marks the clinical onset of disease. So finally you get elevated blood sugar levels. The typical symptoms appear in this stage, such as increased thirst, frequent urination, loss of body weight, and even a life-threatening condition called diabetic ketoacidosis. Once type 1 diabetes is diagnosed, it can be managed by insulin. And basically, insulin remains main route of treatment even a century after its discovery. However, insulin treatment can put a tremendous financial burden on a family and society. In addition, serious health complications develop as a result of chronic, lifelong type 1 diabetes, such as cardiovascular diseases, severe kidney, eye, and nerve damage. That brings us to the best possible solution for type 1 diabetes: a preventative treatment or a cure. Now that we understand those stages of type 1 diabetes development, can we successfully, completely halt an occurrence of disease in a child today? Unfortunately, the short answer would be no. However, for decades, researchers have been investigating preventative treatment. An impressive milestone occurred recently when the US Food and Drug Administration approved for the first time a medication for stage 2 diabetic patients, which acts on those T lymphocytes and delayed diabetes development for about 2 years. There are ongoing clinical trials for stage 2 and stage 3 patients. In addition, the success of stem cell-derived insulin-producing cells provides hope for a type 1 diabetes cure. This is great news, right? However, we have to be cautious since preventative treatments require early intervention, often in seemingly healthy, not yet clinically diagnosed individuals. Let's switch a gear and let's take a look at how the world is affected by type 1 diabetes. The top 5 countries with the highest type 1 diabetes incidence among the United States are Algeria, India, and Brazil. Or let's take a look at this map showing estimated life expectancy of a 10-year-old child diagnosed with type 1 diabetes in 2022, where remarkable differences exist between, let's say, sub-Saharan Africa with life expectancy of less than 25 years of age, in contrast to Scandinavian and West European countries with life expectancy of over 70 years. It is unrealistic to expect those preventative pharmaceutical treatments to be accessible in these developing regions. There are investigations into potential non-pharmaceutical approaches. For instance, breastfeeding, early avoidance of cow's milk proteins, gluten, addition of probiotics, vitamin A, vitamin D, and traditional medicine exploited herbs and substances all have been proposed as candidates in those preventative efforts for type 1 diabetes. However, results of such studies have been inconclusive. In our immunology laboratory at St. Cloud State University, students have studied several non-pharmaceutical substances known for their anti-inflammatory properties using mouse experimental models for type 1 diabetes. These might be potential resources for developing regions. Garcinia cola, bitter cola, or basically nut, widely enjoyed in Nigeria. Yerba mate, famous Brazilian and Argentinian herbal infusion. Or, closer to home, particular emerging version of CBD. All have been tested in our lab. Currently, voluntary exercise is being studied, showing exciting preventative effects in our mice. In addition to being a researcher of type 1 diabetes, I'm an avid public health devotee. From public health perspective, early detection of children at risk for development of type 1 diabetes by screening for those known biomarkers would be a significant first step. In Minnesota, if you have a relative who has type 1 diabetes and you have certain age, definitely not my age, you can be screened for those biomarkers. However, in Germany, in Bavaria, they conducted free screening for all children, knowing that 1 in 250 kids will develop type 1 diabetes. Progress on preventing this disease is not limited to research. You can be a partner in this effort. If you or your family member are at risk for development of type 1 diabetes, get yourself involved in clinical trials. Have a conversation with your child's pediatrician about screening for those biomarkers. And even more, accessible screening for all children in Minnesota, if not the United States. I told you in the beginning that I chose type 1 diabetes research for love. Remember? Well, today is our 39th anniversary. Thank you, thank you, thank you. Am I spending tonight on a romantic dinner with my husband? No. I'm here with you, talking about and raising awareness about type 1 diabetes prevention. Thank you.